Hey everybody, welcome to Pick Dr. Osborne's Brain. We got a great Q&A for you today. If you've got questions that you'd like to ask, make sure you go ahead and start putting those into the feed now. This week's all about alcohol, so if you've got alcohol-related questions, metabolism-related questions, gluten-free related questions around alcohol, those are ideal. Those are the ones that I want to take and answer today. If you missed the show earlier this week, make sure you go back and check out the replay where we did a complete breakdown of all the gluten-free alcohols, what to look for and what to be cautious of. Okay, and also don't forget to check out our sponsor, Gluten-Free Society. This week I think it's Ultra Food VF. So if you're looking for a super greens drink that's grain-free, that doesn't contain the barley grass, the oat grass, the wheat grass, and all the other grasses, Ultra Food VF is what you want to go with. Use promo code SUPER and save $10 off this week and this weekend. Okay, let's dive into some of these questions. Matthew Gibbs says, where can we get a t-shirt like that? I think he's referring to the shirt I was wearing on Tuesday. That shirt, which is our gluten-free, thankful that tequila and rum are gluten-free shirt. You can't buy those. Those were just shirts that we had made. We had a limited edition orders made, and we'll be announcing details on how you can get one, at the end of the show today, so stay with me. Let's see. Mohammed says, hope you're doing well. Just a quick one. Can low potassium cause anxiety? And also, why does taking thiamine throw out potassium? I wouldn't say that taking thiamine throws out potassium, but I would say that low potassium can definitely contribute to anxiety. So I don't know where you heard about the thiamine potassium throwing, but I don't necessarily say that I would agree with that. Why would, see here, Dennis says, why would a psychiatrist recommend a high-protein diet for people with ADHD? There's a lot of reasons why, somebody might have recommended a high-protein diet. ADHD, attention deficit hyperactivity disorder, I would surmise without being in that psychiatrist's head, because I don't want to presume what they were thinking, but most people are already eating too little protein and too many carbohydrates. And so there's this imbalance in the macronutrient ratio in the standard diet. And one of the things that we are certain of is that you need protein to form the basis of most of your amino acids, especially your biogenic amines. So you need amino acids to make dopamine. You need amino acids to make serotonin. You need amino acids to make histamine, which are very, very potent stimulatory neurotransmitters that help with memory and cognitive function. So I would imagine that that's probably why he was making that recommendation. Let's see here, Mario. Hi, Doc. I usually don't drink alcohol, but on the occasion I have half a glass of wine, I get severe night cramps. Is it normal? Or may it be a sign of an underlying condition? So if I'm reading this right, you get night cramps only when you drink that half of a glass of wine. There are a lot of reasons why that might happen. One, some people are allergic to the sulfites in wine, and so that could be a potential for you there. Number two, half a glass, I'd say if you're drinking half a bottle, it'd be different, because half a glass is probably not going to behave like such a strong diuretic it should cause cramping. But you could be allergic to the grapes. I've had people who are actually allergic to wine, not just because of the sulfites, but actually allergic to grapes. And so, consuming wine was a really bad idea for them. So I would look at it as a potential. If that happens with other alcohols, you might explore some other options. But if it happens with only wine, I would surmise that you might have an allergic or sensitivity reaction to wine. Adriana's asking, can you please tell us the D3? I'm going to assume you mean IU and not UI, so international units for a 9-year-old. It depends. If you're talking about just like a safe level for a 9-year-old to take in general, if the 9-year-old is in good health, anywhere from 2,000 to 3,000 IUs a day should be perfectly fine. But it's again, it depends on weight too. Not all 9-year-olds weigh the same. I would look at getting the 25 OHD levels tested, and if you're going to supplement in the thousands of IU range. So if you're going in that 3,000 range, get the level checked after about a month just to see what the levels are doing. But 3,000 for a 9-year-old is a pretty safe range. Anything general about gluten in autism? 50-year-old ADHD, Asperger's son suffering from anxiety. Is there anything general about gluten causing it, or gluten contributing to it, or gluten exacerbating it? Yeah, there's lots. Where the popularity of the gluten-free diet with autistic and ADHD came in was just parent groups. This was probably 15 years ago. On the message boards on the internet, this was before the internet is what it is today, there were a lot of messaging boards where parents would get together and chat about diet changes for their kids with these different types of conditions, and find that gluten-free, casein-free diet was tremendously benefit for kids with autistic behavioral diagnosis. And so it became more and more popular, and now there have been a number of research studies confirming that many children with ADHD and autism actually do experience improvement in symptoms when they go on a gluten-free as well as casein-free diet. So that's basically gluten and dairy-free diet. So yeah, if that's beneficial for you, if you've got a kid with those diagnoses, it's certainly, diet change doesn't hurt anyone, but the possible outcome of benefit could be tremendous for you and for your son. Let's see here. Nicole's asking, my micronutrient test, I'm deficient in oleic acid and serine, borderline calcium, choline, chromium, fructose, sensitivity, panthenate, zinc, raise. Is there anything else to look at? I'm not sure I understand your question. Is there anything else to look at? In what regard? If you could be more specific for me, Nicole, I could answer that better. Do you have any ideas on what to do with my old empty supplement bottles? I literally have hundreds of them collected over time. What should I do with them instead of throwing them out? Not really. You could try to recycle some of them if they're made from recyclable materials. But that's the $1 million question, isn't it? If somebody would figure out what to do with old supplement bottles that was a unique twist on things, there's possibly $1 million entrepreneurial idea there for you. So I don't have that idea though, at least not at the top of my head. Let's see, what do you recommend for bone improvement? Exercise. Number one way to increase, if you're talking about bone density, number one way to increase bone density is through physical pressure on the bone. So weight resistance exercise would be number one. And then of course, a good clean diet, with minimal to no sugar, because the sugar, is linked to bone loss as well as inflammation that will steal and leach nutrients from the body to deal with the inflammation. So exercise and a clean diet would be the first two things on the top of the list. Can iodine and selenium be taken together with thyroid script? So iodine and selenium can be taken together, yes. Can you take iodine and selenium with your thyroid medication? You're not supposed to. Most thyroid medications state very clearly that you want to take those on an empty stomach away from food or other pills or other items. So it's always best to ask your doctor, but in my opinion, I would take the iodine and the selenium away from the medication. Are cold shower rinses a good idea to undergo when one is susceptible to cold? So if you have a cold or a flu, is it a good idea to take a cold shower? In my opinion, no. Cold shower when you're already in a state of severe stress, trying to battle an illness, not so much. Not unless you're trying to break a fever. Although I do like the idea of cold showers and parasympathetic tone, meaning they help to promote parasympathetic nervous system function, but not while you're sick. Not a good idea. Let's see here. I've lost my sense of taste and smell from the disease that shall not be named. I guess we could call it COVID nowadays. Is this This is day 9 being sick. What can I do to get back? 2 things that I would tell anyone with loss of taste and smell, whether it was COVID or any other, virus, is zinc and quercetin. Those 2 things, but you got to have the right amount. So with zinc, you need upwards of 75 to 150 milligrams of zinc a day, and you can do that for several weeks very safely. The second thing would be quercetin, and I'd say at least 3 grams a day of quercetin. Same amount of time, at least 2 weeks. And this is beyond the illness. You can take it during the illness, but taking it beyond the illness. Zinc is what's responsible for taste and smell. So the olfactory receptors of smell depend on zinc, and so do the gustatory centers on the tongue. So you want to get that zinc into your cell in rapid pace. And the reason why so many people lose their taste and smell with COVID is because it rapidly depletes zinc. And so you want to get that level back in you and back up. And the best way to do that is to take supplementally, but also using quercetin. Quercetin is what's called an ionophore, which pushes zinc into the cell. And so again, high dose quercetin, high dose zinc, would be the 1-2 punch I would recommend anybody who's lost their taste and smell from from a viral infection. So question on why do I cramp badly when I cycle out of ketosis? I basically load up on small, moderate amount of carbs, 20 to 30 grams at night, and the cramp attacks are horrible. My ankles get affected predominantly. It might be what's in the carbohydrate and not necessarily that you're cycling out of ketosis. You might try doing different types of carbs specifically, keeping track of what they are. I mean, it could be that while you're in ketosis, because you're not really eating the carbs, that you're not reacting because you're not being exposed to certain carbs you might actually be allergic to. And so that would be my first thought. If it's causing cramping like that, it's not so much maybe that you're cycling away from ketosis as it is the actual food that you're eating to cycle away. What can you recommend for a baby that has chronic ear problems? If you mean like chronic ear infections, diet change. I see it all the time in kids where they're susceptible to frequent upper respiratory and ear infections because their diet is conducive to the growth of abnormal bacteria or fungi, in the ear or in the sinuses. And so what does that mean, diet change? You start with no grain, no pain. If you don't have a copy of the book, you can check one out at the library. You can pick it up on Amazon or any major book retailer, but follow the 30-day diet plan with the child. And a lot of times we'll see that diet change clears it up without the need to do additional things. If it doesn't, then you come back and you can ask me, okay, what next? Now what are some things that can be done beyond the diet? What's my opinion on CBD gummies? Are they usable for pain reduction and mostly scams? No, CBD works. Where you get into the whole gummy stuff is like, what's the gummy made out of? A lot of times those gummies are made out of corn syrup and other garbage. So I don't agree with using a gummy that's made from unhealthy things as a carrier for CBD, but CBD can actually work quite well. We have a product called Ultra Hemp, which is a standardized amount of CBD cannabidiol in it, and so it definitely can work. And where we see it work best is when people struggle with neuropathy or neuropathic types of pain. But it is not a scam. Now, that being said, it doesn't work for everyone. It's not a one-size-fits-all approach, and really, honestly, if you're struggling with pain, a better question to ask is why you're struggling with pain, not what can I take to alleviate the pain, but why am I actually having the pain? So going back to root cause versus symptomatic reduction, through something like a CBD. So I would give you the same advice: no grain, no pain. I wrote that book for a reason. Many people struggle with chronic pain, whether it be physical, arthritic, or neurological pain, or whatever your pain is. And diet change, because diets can be super inflammatory and lead to pain, a change in diet oftentimes can resolve pain for many folks. And then you don't need the CBD. So then, in that regard, it's a scam if you haven't changed your diet and you're having to rely on expensive CBD for the rest of your life to have some type of quality in pain reduction. Okay, so I think this is a follow-up question. So again, going back to Nicole, which was she was asking about her nutritional deficiencies, and then I guess what you're asking for is what other tests that you can do to help assess your nutrition. At least that's what I'm reading from your commentary. So to properly assess somebody's nutritional status, number one, you need to know what their nutritional deficiencies are, right? So you've had that type of testing done. So what else can you do? You need to have your GI tract properly assessed. Your GI tract is where digestion and absorption occur. So there are certain types of tests that can help you evaluate whether or not you have malabsorption or digestive issues. You can measure your enzyme levels. Your pancreatic enzyme levels are very important to help you break down your food. And so that's another one that's very helpful. You can also have your liver function assessed, because the liver is important for the production of bile, which aids in the absorption of fats, and you're deficient in oleic acid, and that again being omega-9, which is a type of fat. So if you've got a liver problem per se, it could be why you have that particular deficiency. So assessing digestion, absorption by looking at the GI tract, the liver, and the pancreas, which are the accessory organs to digestion, is also an important good step to take if you're trying to understand overall nutrition for yourself. Can learning disabilities be reversed? Give me examples of the learning disabilities. If it's a neurological abnormality that occurred as a result of a certain neurological stage in development, you don't reverse those types of things. But give me an example of what you mean, and I can give you a better answer. Let's see, can I take L-glutamine with NAC with or without food? Yeah, yes, you can take L-glutamine and NAC together. It's best to take them without protein, Chip. And the reason why is that glutamine and NAC are both amino acids. So if you take those two supplements with a bunch of other protein, then the protein in the food might interfere with the proper absorption of glutamine and NAC as far as competition. So the receptor sites for absorption, that protein might interfere with that. So you'll get better absorption out of glutamine and NAC either on an empty stomach, or if you take it with some small amount of food that is not heavy protein based. Hello, Dr. Osborne. Lab work shows absolute eosinophils 132. Range, I don't see the question there. If you're asking about your eosinophils being at 132, is, I guess, I'm not sure what your question is. Do you think liquid IV is really beneficial when you're sick? No. If you're talking about the product itself, no. I think that product, I don't like to say anything bad about other people's stuff, but it's just not one I would recommend. What kind of allergy test do you recommend to take? What to look for in a food allergy test? Put the link up for Mario of our food sensitivity tests in the feed here. No, they don't all work equally. Oh, I see you're in Europe. Yeah, we're working on an international solution. We just don't have it yet. The best thing, I'm not in Europe and I don't practice in Europe, so I don't know what kind of lab tech they have available overseas in that regard, but I would just encourage you to ask your local doctor there to look at measuring IgG, IgA, IgM, and IgE responses to foods. Like if you did those four, that would be, it's not as good as something that like what we offer at Gluten-free Society, but it's far better if you had all four of those measured than having nothing and no information at all. So that's where I would tell you to go and look. Okay, here we go. So this is, Laura was asking about her eosinophil count. So that her level is 1,372, not 137, which is quite high. So why would eosinophil counts on a blood test be high? There's a couple of simple reasons why. Number one, you could be being exposed to something that you're severely reactive to in your environment. So one of the things we'll see drive up eosinophil counts in the environment would be like if you had mold in your house and you were allergic to that mold, and so your eosinophil counts were going up in an effort to try to combat that. Number two, you were eating foods that you had IgE responses to, and that's where you would see eosinophil counts going up as well. So there are certain conditions like EOE, esophagitis, which is an eosinophil infiltration into the esophagus because a person's eating some foods that they shouldn't be eating, that their body is reacting to, and that can, again, drive up histamine. So getting your levels of IgE antibodies against foods checked might give you some determination as to whether or not that's happening for you. And then the third commonly would be a parasite infection. One of the ways that parasites show up on standard blood work is through elevations in eosinophils. So either three of those things would be where I would recommend that you get with your doctor and ask and start looking for those things specifically. Can ashwagandha cause liver enzymes to elevate long term? I've not seen that be the case. Now, there's some reports that say that can happen, but I've not ever seen somebody on ashwagandha for long periods of time actually have problems with liver enzyme elevations. Again, that doesn't mean it can't happen. I'd say if you have a real concern with it, simplest thing to do, if it's helpful for you, because ashwagandha as an herb to help with stress and stress recovery, it can be very effective. Just check your liver enzymes every 3 months as you're taking it. Check your ALT and your AST and your ALP and your bilirubin and ferritin. Those 5 things are good markers for possible liver issues. And so if you find those markers are going up during the time you're using it, then that's your cue in to possibly reduce it. Okay, so back on the question of learning disorders being reversed, dyslexia being one. No, not so much. I mean, I don't even know that dyslexia, I don't even know that I would call it a learning disorder as so much as I would call it a processing difference. People have processing differences. Some people can look at a page and remember a lot of the words and recall a lot of the things on a page. Other people turn words and reverse words when they're trying to read because they process and their brain processes things differently. It's not necessarily, I don't agree with standard psychiatry in that we would call that a disease, because a lot of the people that I've seen with dyslexia have other superpowers of processing. They just don't do well, and so they're not the best person to write a novel without making a ton of errors or mistakes. Okay, let's see here. Question somebody's asking about coming down with COVID 3 times since 2020. Why do I keep getting it? Well, I mean, the number one question I would ask is, did you get the jab? Because we're seeing a lot of people that have had the jabs repetitively keep getting sick. And so that, without knowing much about your history, it's hard to, make comment there. I mean, the other aspect would just simply be, how healthy are you? How healthy is your immune system? How strong is it? If you're getting sick that frequently, in 1 year, then, we got to look at, I would encourage you to look at, why that is through the lens of your immune system's functionality. And so a lot of people just are eating poorly. They're not exercising. They're not getting adequate sleep. They're not getting adequate sunshine. They're, not drinking filtered water. They live in a highly polluted, condensed population area where there's, poor air quality. And so you got all those things working against you. So what is it that you can do in your life that would improve those areas of your life so that you could bolster your immune system? Can anything nutritionally or chiropractically be done to reverse or arrest lymphedema? Yeah, dietary-wise, gluten-free diet, hands down. It's one of the most effective things I've seen in cases where people had lymphedema. Chiropractically, yes, I've seen cases where people, were adjusted appropriately and it improved or helped with their lymphedema as well. Now that's to say that it's not necessarily a cure-all for everyone's lymphedema, but certainly worth a try. Love that. Marie says, making your panettone recipe Yeah, so if you guys haven't seen our new panettone recipe, it's fantastic. I don't know if we have a link to that. We could put it up in the feed for those of you maybe who haven't seen it. But yeah, it's a great one. Great one to make for the holidays. Speaking of alcohols, the alcohol and vanilla extract okay. Is there a brand that does not include alcohol? I haven't looked at specific brands in terms of asking what kind of alcohol they're using, so I can't answer the brand part of that question, Joanne. But I make my own vanilla at home, and so we use Madagascar vanilla bean, and you can just use a pure distilled spirit. Vodka works well to make vanilla. One of my favorite kinds of vodka is ocean vodka. I went to Hawaii this past year. It was my 50th state on my 50th birthday, so I'd been to 49 states in my life, and so Hawaii was my 50th, so we went and celebrated 50, and we went to the actual facility on the island of Maui that produces ocean vodka just to check it out. Fantastic setup, so those of you ever get a chance to go to Hawaii, go check out Ocean Vodka. They've got a beautiful hilltop grassy area where you can have lunch, and they have actually really good gluten-free food options and good organic food options there. But they make one of the very few organic vodkas, and their vodka is actually produced from sugarcane, but it is super, super smooth. So if you have had vodka and it was too harsh or too guttural, sometimes the spirits are really harsh. This is one of the most smooth vodkas I'd ever consumed, and I'm a fan of ocean vodkas, particularly because it's organic, and they don't pay me to say that. Like, I'm not receiving any kind of financial retribution from those folks. So just good vodka, that's all. Let's see here. Yeah, so going back to having COVID 3 times. The initial shot. So if you've had, this is just my opinion, again, take it for what it's worth, because I know lots of people had to make decisions. In some cases you were making a decision because you thought it was the right thing to do. In other cases you had to make the decision to keep your job or whatever it could have been, right? No judgment for me there. If you've taken the jabs, my opinion, you should be on vitamin C. 5 grams a day if you're an adult of 120 pounds or more, and you should be on N-acetylcysteine, 2 grams a day. And I would stay on that cocktail. It's safe to stay on. I would stay on that cocktail to weather through this storm. We've seen a lot of people, post-jab. I get a lot of people that come visit me post-jab, and their immune systems aren't the same, and they're really struggling. And so those 2 things we've done with a lot of folks and found it to be very, very effective in getting their immune system supported and back up and going. So I would start with those 2 things. Let's see, go down on the right side up top there. Do I approve of flaxseed to repair leaky gut? No, I don't, not really. Flax, I don't approve any seed oil really as a repair mechanism for leaky gut. I mean, you can certainly incorporate flax in your diet, but in my opinion, it's an overrated superfood. I don't think flax, first of all, flax does not really provide omega-3. It's kind of a misnomer that it provides omega-3. Flax provides linolenic acid, which has to then be converted into omega-3 biochemically speaking. And so some people don't do that conversion very well. So flax actually puts more stress and pressure on the body in that regard if you're a poor converter. Let's see, go up just a hair on that. Natalie says, almost every time I eat Chipotle, I get super bloated, like 3 months pregnant. Yeah, Chipotle's not good for you. Ideas on why it happens. There could be a lot of reasons, Natalie. I would say the biggest and most obvious reason would be understand that although Chipotle has kind of a connotation of being a healthier fast food, the food is not organic. The meat is not grass-fed. Chipotle is owned, I believe, by McDonald's, which, you don't really want to trust, a company with scalable logic, corporate logic of that company to supply you with one of the most important assets to your body, which is your food. I'd also just remind you of rule number 3 of nutrition, which is if your body reacts when you eat it, every time you eat it, stop eating it. Because there's something in it that you're reactive to, or there's just something about it that your body is perceiving to be unhealthy for you, and so it's just trying to warn you away from it. Let's see here. I like some of these comments, people chiming in with organic vanilla powder options and organic options of vanilla without alcohol. Thanks for chiming in. Not sure I understand this question. Gina says, I'm intolerant to tapioca, which is used in gluten-free holy bread. Would you recommend taking? Thanks. I mean, if you're intolerant to tapioca, and yeah, I don't recommend that you use a tapioca-based bread. You have other options. You have arrowroot as an option. You know, you've got almond flour, green banana flour, chestnut flour. I mean, there's a lot of different flour options to make bread with, you know, if you're reactive to tapioca. Okay, question on alcohol. Let's see here. I think Doc, as an alcoholic beverage, is Fermented, the Italian herbal spirit, a healthy gluten-free option? What's it fermented from? Would be the question. I'm not familiar with Fermented, so I can't comment intelligently, Mario. If you could tell me what it's derived from. I mean, the best thing that you would do is you would call the manufacturer of the company and ask them what they're using, you know, in regards to that, what they're using to make it. The other thing would be to ask them if they sweeten it with anything else, because if it's just an herbal spirit, like a pure distilled spirit, that as long as it's not being distilled from a grain, it should be okay. Let's see here. Is NAC safe for people who take blood thinners? Yes, perfectly fine. How should I calculate my need for calories? You know, there are basic metabolic rate calculators that you can Google search that will give you a formula for men. There's a different formula for men and women. And those are base estimations. I mean, I can give you kind of a very base estimation as a male. And part of it depends on what your goals are too. So like if you're trying to build muscle, or if you're trying to just maintain your weight, or if you're trying to lose weight, this is where getting a BMR calculator that takes into account your height and your weight and your age, and then it will use a mathematical equation or formula that gives you a baseline estimate of how many calories you should eat or consume each day that would allow you to maintain your current weight. So depending on what your goal would be from, you know, if your goal is maintenance, it gives you a good number. If your goal is, no, I want to weigh more, then you have to adjust your calories upwardly, you know, accordingly to what your goals are. Or if trying to lose weight, you know, same, vice versa. Do you know if aluminum is directly linked to breast cancer? Yes. You know, one of the big problems, Natalie, with some of these deodorants, and really not so much deodorants as antiperspirants, they had aluminum fragments in them that would lodge into sweat pores. And that was part of how it stopped women from sweating. And so, you know, there definitely are epidemiological studies linking aluminum exposure to breast cancer. The doctors are always going to deny that, because that's just kind of the standard of care across the board. Anytime we find an association and a disease association with something that's being used as mainstream, it's always denied, and it's usually denied for 20 or 30 or 40 years until the evidence is so overwhelmingly there that it can no longer be denied. I'll give you a perfect example. You know, when I was a kid growing up in the 70s, lead was in gasoline. Like, you go to get gasoline and you had two choices. You had leaded and you had unleaded options, right? So lead was a common additive to gasoline because of its preservation abilities. Lead was in paints. Lead was in children's toys. Lead was used as a solder for piping and plumbing. Today, that's not true. Why? Because after enough epidemiological data has evolved over the years, we finally realized medicine we finally realized, because many scientists were screaming about the toxicity of lead for years before the powers that be finally said, okay, we concede that lead is actually a problem. We're going to remove it from paints and toys and gasoline. So I think that's where we're at with aluminum. I think that's kind of where we're at with mercury too, because dentists still use silver amalgams with mercury in them. And of course, pediatricians still use aluminum and mercury adjuvants in their vaccines for kids. Which in my opinion is dangerous and irresponsible. It's never an okay thing to inject a child under 2 with known caustic toxic chemicals, but that's a topic for another day. Let's see here, go back up just a little bit. Can NAC be taken, a lot of questions on NAC today, can NAC be taken for type 2 diabetes can somebody with type 2 diabetes and high blood pressure take NAC? Yes. Yeah, there's no contraindication for somebody to take NAC. NAC is very, very safe. It's an amino acid. It helps your body generate glutathione, and it's also a mucolytic. So if you've got chronic sinusitis or chronic mucus filling in your sinus cavities, NAC can be a fantastically wonderful supplement to take. Help my body overnight is itchy all over, elbows, knees, ankles, and hands, red and in pain all over. I have been taking a little gluten every day with an enzyme to remove digestion. I mean, that's such a big ask, Jenny. I'd say the best kind of generic help I can lead you toward is no grain, no pain. If you're finding that that you're having a mysterious kind of rash develop and skin itchiness develop, 1, go see a good doc, but 2, if you're trying to look for dietary angles and reasons as to why that could be happening, we see that thing happen a lot in people with gluten sensitivities, so that's definitely a place that you can start. And if you're flying blind and not quite sure what gluten is, again, you can read No Grain, No Pain. You can also sign up for my Glutenology Masterclass. It's absolutely free to do, and we can put a link up underneath for you to access that. How do I increase my IgA? I have DQ8, gluten sensitive and gluten-free for 10 years with currently low total IgA, but still have anti-gliadin IgA. Yeah, if you have high mycotoxins, if you're in the middle of a mycotoxin issue, you'll never get your IgA up. IgA, I see it all the time in people who have mold toxicity issues. They have IgA suppression. So I'd say if that fits you, if you're going through that right now, get through that first, and then keep an eye on your IgA, and you might just see it make a rebound as you get the mold out. Yeah, another person, or I think the same person actually said my IgA for gluten is high. If you have anti-gliadin antibodies, IgA anti-gliadin antibodies, then you're being glutened. And so you have to look at any kind of processed food that you're taking in, period. And you've got to remove those because you're still getting exposure somehow, some way. If you, again, I send you back to my master class. I have a whole module on cross-contamination and things you need to be aware of. Because research is very clear on this. Cross-contamination at 20 parts per million is enough gluten to cause a chronic inflammatory response that can last for up to 2 to 3 months. So you've got to get, if you're what we would call a refractory responder, meaning you're still struggling to overcome because you're getting even small amounts of exposure, you've got to really dial your diet in super, super tight. Scroll down.
That's the bottom for right now.
Okay, so do you think that someone who is not sexually active and is over 21 needs to get a pap smear yearly? Yeah, that's a big question. Look, here's my opinion of pap smears. I don't think they're all that valuable of a tool of assessment. I think more than anything, they're just a socially acceptable thing that women have been told they need to do because that's one of the things that OB-GYNs do. What's the point? You're looking for, precancerous lesions, on the cervix. That's what a pap smear kind of helps to detect. But if you're perfectly fine and healthy, to go in and have your pap smear where you scrape cells off, I'm just not a fan of that. I'm not telling you not to go get one, but I'm just not a fan of them, even if you are sexually active. What they're looking for is abnormal cells on the cervix, oftentimes referred to as cervical intraepithelial neoplasia. So it's like precancerous cells. Generally, if you have a positive pap smear, the next step is they're going to want to do a LEEP or a cone procedure on your cervix. And I would just say this to any young woman, there are cases where getting these procedures done scars the cervix, especially those deep cones where they go in and they lance out tissue and pull out tissue. So now your cervix heals back up and it's scarred. So that when you go on and you want to start a family and start having children, if you have scarred or damaged your cervix and it doesn't properly dilate during your pregnancy, during your as you're going into labor and it doesn't properly dilate, what ends up a lot of times happening is women end up needing cesarean sections. All for the fear of whether or not you might have human papillomavirus, which HPV is a virus that has been associated, I'll say weakly so, associated with cervical cancers. I'm not a fan of the pap smear. I mean, we could do a whole show on my opinion of that, but I'd say if you're debating whether or not you should get one, who should get a pap smear? And this is my opinion, and I'm not an OB-GYN, but my opinion is if you're having major hormonal shifts or problems, major female problems, go get checked out. But if you're perfectly fine and healthy, to go in and just get a pap smear just because, in my opinion, the information you gain from a pap smear can oftentimes lead you down a road that you don't need to go down and can create a problem for you. Let's see, TC says, hi doc, you mentioned taking NAC every day. How much and why and what are the benefits? NAC is a precursor to glutathione. It's one of the most, and glutathione is not absorbed very well. So if you take like a glutathione supplement, most of them, if they're not done properly, you won't absorb them very well. So NAC helps you make glutathione. That's one of the benefits. And glutathione is the body's master detoxifier. So it helps push chemical toxins and other environmental toxins and jab toxins out of you. That's one of the benefits of why I would say take it every day if you've had, especially if you've been double pumped. Hopefully that answered your question. Can thyroid nodules and cysts of suspicious nature be reversed? Yes. What causes blood clots? Husband was admitted to ICU in September with blood clots in legs and right heart ventricle. Well, I'd just say, because I think this is the same person that asked earlier other questions, but if he was also given 2 shots, the first suspicion I would have is what was causing his blood clots would be the shots themselves. In private doctor circles, we have a name for those. We call them clot shots. So be aware that may be part of what's happening, and it should default back to the other thing that I mentioned, which is taking NAC. Not that that'll stop him from clotting, but it certainly will help support him. Other things can cause clots, though, not just that. Poor diet increases the clotting cascade. Poor levels of magnesium or magnesium deficiency can increase the risk for clots, because magnesium plays a role in platelet aggregation. And then you have other things that increase the risk for clots, like excessive sugar, excessive carbohydrates in the diet, inflammatory foods in the diet can increase your risk of clotting. So there, a number of different things that can do it. I'd start them on if your husband is having that kind of an issue. I'd definitely, if you're just trying to make a change in the diet, start him on no grain, no pain. Get it going. And then ask the doctors, to monitor his prothrombin, his fibrinogen, his D-dimer are all important tests to measure for clotting and microclotting. And if you have good baselines where he's having clots and his baseline levels of those lab tests are at a certain level, as you change his diet, what sometimes you'll see as you monitor those levels over time is his diet changes, his D-dimer might go down, or his fibrinogen might go down, or his prothrombin might improve. Like those are things that you can talk with his doctors about to measure and monitor as you're trying to implement diet changes to help him. How do you get rid of thyroid nodules even if TSH is low? If your TSH is low, you're probably being over-medicated unless you have Graves' disease. If your TSH is too low, you're probably being over-medicated with your hormone, with your thyroid drug. So talk to your doctor about that possibility. We have an entire show, Natalie, on the thyroid, and it'd probably be better serve you to check that show out. I don't know if we can find the link and put that up for Natalie on the fibroids and the thyroid. Do I think that small dental silver fillings should be considered for removal? Depends. I would say, number one, anytime I'm seeing somebody and we're trying to make that kind of a determination, one of the things I do is check their mercury levels. Check them to make sure they're not mercury toxic. If they're not mercury toxic and the filling is stable, then it's a judgment call whether or not a person should do it. But if we find that their mercury levels are very high, and then it becomes in my opinion, more of an important priority for their health to get those fillings out to reduce their exposure to that mercury. So Barb's asking if thyroid nodules can be reversed, how? I follow your diet protocol and take your supplements. That's kind of more of a specific question, probably better discussed privately or in a one-on-one conversation, because there's a lot of nuance to the hows beyond the generalizations. Let's see, just got Dr. Osborne's Microbinder after 3 months of cholestyramine and moving from mold. Any contraindications? I mean, if you're taking Microbinder, there's no contraindications. I mean, it's very safe to take. Generally, the general recommendation is take 2 capsules 3 times a day on an empty stomach. Can superfood product be beneficial as a first step to help a psoriasis condition? No. I mean, if you've got psoriasis, don't rely on a superfood to fix your problem. If you've got psoriasis, generally, in my experience, psoriasis is caused by food that you're eating, and it's not always the same for everyone. So, I see a lot of people that are eating superfoods when they come to see me, and they still have psoriasis. And one of the reasons why is that sometimes they're allergic to some of the ingredients in the superfood product that they're using. Not that that's what's causing their psoriasis, but it certainly isn't helping it. It's allowing it to perpetuate. I mean, psoriasis is an autoimmune skin disorder. And joint disorder, psoriatic arthritis, which is, they kind of teeter back and forth. A lot of people with one have the other, and vice versa. And so you've got to really look, instead of looking for what superfood to take, look at what can be the trigger for the actual autoimmune condition. There's 4 categorical triggers for autoimmunity: food, chemical exposures, nutritional deficits, and microbial imbalances. And so those 4 things, in my opinion, for anyone with autoimmunity, those 4 things should be measured first as a guideline for that person to follow in their diet and lifestyle. And because once you know what your triggers are and you remove them, now your body has the potential ability to begin the healing process. And so again, it's not that you can't use a superfood product, it's just that I wouldn't take a superfood product expecting, any kind of big miracles. What causes a person to get migraines from even the cleanest of supplements? You probably have mold. I mean, the number one reason that I'll see people reacting to their supplements in a negative way, especially like migraine headaches, neurological reactions, is mold in their environment, Kim. So, you might just, start turning some of your attention, time, and effort into investigating whether or not you have a mold issue, particularly environmental mold in your home. Need a gluten-free vinegar. Apple cider vinegar is a good one. Oh, can't use apple cider vinegar. Try plum vinegar, organic plum, or balsamic vinegar if you're not reactive to grape. my opinion on whey protein in general for the body. I'm not a fan of whey protein, predominantly because it's derived from dairy, and a lot of people with gluten reactions don't do well with dairy either, Deanne. That's why, like, I have two types of proteins that I generally recommend in my practice. One is a bone broth beef protein. So that for those of you who aren't, vegetarian or vegan, that one would work best. It's called ultra pure protein. The other one is a organic pea protein. It's called warrior protein. And so those are the two that if you're supplementing with protein, I recommend those. Or you could also take we have a product called Ultra Aminos, which is just free form amino acids. And so it also provides a great source of protein if you don't like big protein shakes. You can get free form amino acids, and with a couple of teaspoons a day and in a small amount, a few ounces of water, you can knock that back, and it's a great source of viable building blocks for protein. Let's see here. My dad takes ibuprofen almost daily for severe shoulder arthritic pain. He has bone on bone and will be needing a surgery to repair it. What can he do for pain relief? I recommend something called white willow complex. It's a formulation that we have at Gluten-free Society. It's derived from white willow, which is what aspirin is made from, right? Acetylsalicylic acid or aspirin. This particular formulation does not, unlike ibuprofen, it does not strip away the mucosal lining of the GI tract, which is the danger of high doses of ibuprofen over time. It's one thing to take ibuprofen for one day and then you don't take it for 6 months. It's another thing to take it every day to treat chronic pain. I'd also say with your dad, if they're telling him bone on bone, I'll just say this. I've seen this a lot. I used to run a rehab clinic early on in my career, and I would get people all the time in my rehab facility who were told they had bone on bone, and they didn't. They didn't have bone on bone. The orthopedic just told them they had bone on bone because they wanted to do a surgery. And to me, that was a highly unethical thing to say. If you don't really truly have bone on bone, so my opinion for anybody who's ever been told you have bone on bone, get your own eyeballs on the x-ray. Ask the doctor, show me bone on bone. Show me where there's no cartilage. Show me where there's no joint space. I want to see it. Because most people are not bone on bone, but the orthopedic surgeons want to do surgery. So always get a second opinion. That's just another tip of advice I could pass on is never take the first opinion as bond. Always ask for a second opinion, medically speaking, especially when it comes to major surgery. If they're saying we're going to do a joint replacement or something like that, that's a major surgery. You want to get a second and sometimes even a third opinion. But get your own eyeballs on the x-rays to make sure it absolutely is bone on bone, because sometimes it's not. A lot of times it's not. Let's see. So Sylvia says, I used zeolite for 1.5 months and started to get low muscle twitchings. Is that a sign that zeolite pulled calcium and magnesium out? Could have. Zeolite's a binder, and it's used as a chelating agent too for metal, and calcium and magnesium can be pulled. So it's good common practice typically when somebody's taking binders for long periods of time to also be on a mineral formula to try to help offset the loss of mineral nutrients as well. Yeah, so Yesenia says, bought your Ultra Magnesium and loved it for pain and sleep, but was tired and fatigued during the day. Yeah, the best thing to do is to take it at night where it's, helping you be tired when you're supposed to be tired and helping you sleep, but don't take it throughout the course of the day. That would be, some people act that way with magnesium is they actually, when they take it, they're actually a little tired, a little groggy. So if that's you, use it for sleep, but don't take it during the course of the day when you need to be more mental alert. Could very icy drinks be, where'd it go? Oh, it looked like it. Oh, okay. How much time does it take to recover when we go on a grain and dairy-free diet? Razaela is asking. Depends on the person. Many people will see results, like good results, not full recovery, but good results enough to keep them motivated to keep going within the first 2 months. Not always. And sometimes the diet change is a good place to start, but sometimes there are other problems too beyond just gluten and dairy. I see this all the time in people where they're allergic to foods. And so, again, I keep bringing this interview up, but I interviewed Dr. Sina McCullough. This was a number of weeks ago, and one of her testaments or testimonies in that interview was that when she figured out beyond gluten, right? When she figured out what she was reacting to that were from other foods, like within a day, she was able to get off the floor and start walking and functioning again. So in her case, it was really, really fast response. But for her, it wasn't gluten and dairy only. It was other foods too. She had other food reactions. And so sometimes people go gluten and dairy free and have limited or mixed result as an outcome. And it's because they're still eating other foods they're reactive to and they just don't know it and haven't figured it out yet. Yeah, I love this feedback from Natalia. So, because somebody else was saying, so she said, I was told I needed surgery, but all my back pain, neck, shoulder, and sciatica pain went away when I stopped gluten. We see that all the time. No grain, no pain. That's why the book is labeled No Grain, No Pain, because it really does work. How many surgeries do you think we could stop in the world? How many unnecessary medical treatments do you think we could prevent from happening? How many trillions of dollars could we save U.S. taxpayers and global taxpayers who live in socialized healthcare systems if we just pay attention to people's diets and lifestyles? But that's never going to happen. That's never going to happen because you have greedy cartels of medical system cartels who are just making so much money, they don't want to let that go. They're never going to let that go. They're never going to come out with cures for things. They're only going to come out with patches for things because it doesn't serve them in their business interests. To me, this is part of the litmus for any healthcare provider is, are they in it for the money, or are they in it for the passion and the empathy and the love they have for humanity? And I think if they're in it for the money, then you probably have the wrong doctor. And if they're in it because they care, then, if as long as they care, even if their advice is not 100% perfect, at the very least, they care. And when a doctor cares, that means they care to read more, they care to learn more, they care to listen more, they care to do more. But today we're arming a litany of doctors and technicians, really, like people who aren't doctors but play the role of doctors, like physician assistants or nurse practitioners. No offense to any PAs or NPs out there. I'm not saying you don't have a great education. I'm just simply saying we're incorporating in most countries more and more technician type workers to prescribe more and to push the system more without pushing diet and lifestyle change. Can eye floaters be caused and scratches in the visual field be caused by nutritional deficit? Yes. Vitamin A deficiency, zinc deficiency. So what about alcohol? Yeah, we started this conversation on alcohol and it's really gone far away from alcohol. So what about alcohol? The next 2 weeks are the worst for many. I would agree, and you just have to be true and honest with yourself. I'm going to drink some alcohol over the next few weeks. Kind of the way I look at it is when I get together and I want to do it, I can do it and not pay a mega price. But the rest of the year, I live like no other, so I can live like no other. And that is I don't imbibe all the time, so that when I do imbibe, it's not going to wreck me. Is there a way to strengthen hands and thighs after constant sitting due to the pandemic? One of my favorite ways to just get back to motion and movement, and I did this during the pandemic, and this is one of the reasons why I didn't really deteriorate physically speaking, is I had a treadmill under my desk, a desk treadmill. The company that makes the one I bought, and again, they're not paying me to say this, I don't make a commission or have an affiliate a relationship with them, but it's called Rebel Desk, and they make a great treadmill. I've had mine for over 10 years. It's got wheels, so I can roll it out of the way and I can pull up a chair, or I can pull my treadmill out and walk on it, either way. But it's one of the things that if you have like a sedentary type of lifestyle job, that desk treadmill can be a lifesaver physically for your body. I do about 8 miles a day most days on my treadmill at work when I'm in the office. So look at that. I mean, beyond that, go back to the gym, go back to exercise, body calisthenics, sit-ups, push-ups, pull-ups, squats, lunges, jumping jacks, jump ropes, burpees, whatever you've got, push it, pull it, twist it, and tell your body you need it, because the body adapts to your choices physically. If you don't have physical choices that you make, your body will dwindle, it will waste. You will develop muscle loss and wasting. And if you make choices every day that engage the body in activity, then your body will respond by restoring the strength and resiliency of the muscle tissue and the skeletal structure. Do I think that cold icy drinks can be considered as cryotherapy for one's throat and stomach internally? I mean, possibly, but I'd say if you're going to do that, do it away from eating, because when you do that, it also, ice. I'm not a big fan of ice therapy. Where I like to see ice therapy, if somebody has a really, really chronic inflamed injury, and we can use that to get them some pain relief when we're trying to go through some rehab. But if you're talking about a newer inflammatory injury, I don't like ice as the first choice. Ice suppresses blood flow to an area, right? So any area that you put ice on, you're actually stopping blood from getting to that area. Now, it reduces pain, but it reduces the immune system response. And remember, your body is smarter than ice. Your body's trying to get blood flow to that area to help basically remove the damage and the debris from the damage so that it can start lying down new tissue to take the place of the damaged tissue. And so when you use ice, you impede that process. If I recommend sea salt, where are we supposed to get dietary iodine? From seafood, from seaweed. Those are two great places. Fish, ocean water fish, as well as kelp or seaweed would be great sources of dietary iodine. Cheryl's asking, what's my opinion on the new guidelines this week for preventing diabetes? Haven't read them yet, Cheryl. It's on my agenda of things to look at, so can't comment intelligently about that yet. When can I reintroduce foods that I'm intolerant to? If you're talking about from testing, like from food sensitivity testing, minimum 8 months is what I recommend. That gives your immune system one complete cycle where you have, your immune cells live and die every 6 months or so. So it gives your immune system one turnover time so that all the cells that were there reacting to those foods originally are now gone. They've now moved on, and you have all those new cells, those new immune cells, so no less than that. What do I think the main cause of attention deficit hyperactivity disorder is? Honestly, I think the main cause is socialized conformism in schools. I think schools are not designed or set up to appropriately teach children. I think having children who are super sponges sit in a desk for 8 hours a day and not be able to move or squirm or get up or go to gym class and play or go outside and look at nature and be in nature. I think calling them ADHD is a crime against humanity, because what they're really doing is they're taking a normal, healthy, energetic child and diseasifying that child's behavior, and then enforcing drugs or trying to push drugs like Adderall. And we have an entire generation of children addicted to Adderall at this point. And with the recent Adderall shortages, now they're all losing their minds because they can't get the drug. So we've addicted an entire generation to a drug because we've created a social strata or system of conformity that says kids should sit in a desk for 8 hours a day and not ask questions and not think about thinking, right? That you have to learn how to pass a standardized test, but God forbid we teach a child how to navigate the world, and then when they're just naturally curious and energetic, we stomp that out of them by calling it ADHD, and then tell their parents if they don't take the medication that they're going to have disciplinary problems in the school. That's not to say there aren't some that truly do have a problem, but the vast majority of cases I've ever looked at were the latter, or the former, which is the kid that was put in a school and surrounded by people who never belonged in a teaching classroom. And that's another that's a whole nother topic. And this is, if you're a teacher, this is no offense to you personally, but too many of our teachers have zero life experience. To me, you don't go to college and get a 4-year degree and then to go become the leader of all of our children, right? Like, to me, that's like, you haven't experienced enough life of your own and enough worldly experience of your own to be qualified to be a great teacher. That's not to say you can't be a good teacher, but I think when we have an entire army of teachers that have, 4-year degrees and a lot of them are straight out of college and have no life experience, that oftentimes it doesn't make for a good teacher. And then on the tail side of that, we've got a lot of teachers who are there because they have tenure or whatever it might be, and so they've been there and they really don't like teaching, and they're bitter and they're older and they have a very cynical outlook on the world, and they have no place around our children. So I think we have a lot of problems in schools more than we have a lot of kids with disease. Now, all that being said, I think a lot of the true attention deficit can be caused by food additives, food preservatives, and horrible food. And so we can track a lot of behavioral problems back to the diet as well. But I think we've got a lot to unpack in that question. Probably worth a show in and of itself. Oh, I like that. So when is Ultra Nutrients expected to be available again? We're getting it in today, Barb. So we're going to have it in stock today. So those of you who've been waiting, Ultra Nutrients has been out of stock for a little while. It's our premium, gluten-free, grain-free, multivitamin mineral supplement, and it is going to be back today. So if you've been missing it, hopefully we'll have it marked back in stock this afternoon for you. Let's see. Let's see, scroll down the bottom there. I think I've neglected that.
Here's the question
Oh, so questions about a cookie recipe with almond, coconut, and arrowroot flours. May I eat some of those without messing up my gut? Yeah, possibly. I mean, as long as you're not reactive to those types of flours or to the sweetener that you're using in the cookie recipe. I'm not opposed to a person having a cookie here or there, made appropriately. Unless you're, again, the big issue is if you're reactive to those foods. You could be gluten-free, right? But you could also still be almond allergic or almond sensitive. I see that quite a bit. But if you're not, more power to you, have a cookie. Okay, let's scroll down. So what do I think about the iodine issue? Dr. C, I don't know who you mean by Dr. C, says to avoid it, but other docs say we need it. We need it. Iodine's an essential nutrient. Your body cannot sustain itself without iodine. Now, that being said, some people are really ultra sensitive to higher doses of iodine. So, some people taking too much can create a problem. So I think ultimately everybody needs iodine. It's the mega doses where certain types of people can get into trouble. But iodine's an essential nutrient, and so everyone needs it. You can't make T4 and T3 without iodine. You can't regulate progesterone and other female hormones without iodine. So very, very important. What's the best magnesium to take? I'm partial to Ultra MG, Sherry, and it's a blend of different types of magnesiums to work best and in balance with the body. Let's scroll down a little bit more. My daughter is sure that she'll be constipated without oatmeal. She has chronic Lyme and long COVID. What should she do instead? Yeah, I mean, if she's gluten sensitive, I don't recommend the oatmeal. If she's sure she's going to be constipated without it, I understand your frustration maybe with her, Mary Beth, but I'd say first get her, ask her to do genetic testing for gluten sensitivity so that she knows whether or not oatmeal is a bad move for her, and then she can start making a decision based on objective criteria as opposed to just speculating whether or not she needs oatmeal to have a regular bowel movement. Now, if she's got chronic Lyme and long COVID, it's just my experience. Everyone I've seen who's been told they had long COVID didn't have long COVID. They were in mold. A lot of these cases that we're seeing, people that are not recovering after getting COVID or after getting the shots are actually living in a moldy environment, and that mold is immunosuppressive, and so they're staying sick after the illness. So you might also ask her to look into mold as a potential, pathway toward, that as well. We see that a lot with people who have been told they have chronic Lyme. I mean, if I had $1 for every person I'd ever seen who was told they had chronic Lyme, and actually what ended up happening is they were living in a moldy home and then got better when they got out of the home, I'd buy drinks for everybody. I'd buy drinks for everybody in the house tonight. What do you think about homemade kombucha? I'm not a fan of it. I'm just not a fan of kombucha. And even if you're making it at home, I mean, there's still going to be sugar in it. And if it's almost vinegar, what are you doing? Are you just doing it to try to get the probiotics? I mean, because there are better ways to get probiotics, in my opinion, than kombucha. Probably one of the best ways to get probiotics is sauerkraut. Let's see, Randall says, a totally gluten and sugar-free for 7 months, clean diet, I have neuropathy. What would be the cause of fingers being shriveled, lack of blood flow in the tips, it seems, and dried skin and candida? Glucose is always in the 80s. You probably got other issues beyond gluten and sugar, Randall. I would say, get with a good functional practitioner and ask them to measure these 4 categories of things. Ask them to measure for other food sensitivity. Ask them to measure for nutritional deficiency. Ask them to measure for microbial imbalance, and ask them to measure for chemical exposures. Mold being an example of a chemical exposure. But looking at those 4 categories, in tandem with each other, when you hit a plateau with just diet change alone, sometimes can be the best thing to do to overcome the plateau that you hit in your health. I was wondering if you might be adding an individual high dose or riboflavin 5-phosphate supplement to your supplement line in the future. Yeah, we've considered it, and we actually have riboflavin 5-phosphate, just not as a single product in our B complex. And in our multivitamin. So if you're looking to add it, in tandem with other B vitamins, you can do it that way. But at this time, it's just not at the top of our list, Kay. Let's go down a little bit more. Linda says, just finished mailing Christmas cards and was wondering if the glue to seal the envelopes could be a problem. Yes. I love that you chimed in, Linda, because lots of people are doing that right now. Do not lick your envelopes. Use a wet sponge to moisten them and stick them together, or you just use plain old-fashioned tape to tape them down. But keep your tongue off the envelope, because a lot of them can be gluten contaminated. Can bumps on the back of the tongue, assuming taste buds that are enlarged and bothersome, can a food allergy or sugar consumption cause that? Yes, possibly. That is a potential possibility. What blood test can I do to determine if I'm gluten sensitive? You don't need a blood test, Catherine. Do genetic testing. Let's put a link up underneath on the FB feed for Catherine. Genetic testing is what you want to do for determination of gluten sensitivity. Let's scroll down to so Sherry's asking, could I repeat what I said about what supplements to take if you've been jabbed? As a general, vitamin C, 500 or 5,000 milligrams or 5,000 grams. I'm sorry. I've said this wrong 3 times now. 5,000 milligrams a day or 5 grams a day of vitamin C for an adult. And then as well, 2 grams of NAC a day. Those 2 things as a minimum in terms of supplementation. Do you have an opinion on the safety for pollution of consuming kelp and adults from Maine, Atlantic Ocean? No, I don't. Any opinion on consuming Pacific Ocean products with Fukushima toxicity? Yeah, I think the Earth is a pretty powerful planet that has the ability to detoxify itself. And I think if we sit back and we worry solely about the pollution and we never consume those things ever again, I think we run the cost of creating nutritional problems for ourselves. That being said, I think we all could agree that we want to advocate for cleaner oceans and for less spills and for more, personal and not personal, but for more corporate responsibility and accountability around polluting the planet. But I wouldn't. I will just say this: I would eat Pacific Ocean, Northern Pacific Ocean fish. I would eat Northern Pacific Ocean kelp. Atlantic Ocean, I can't really comment on that. I mean, I don't know enough about the pollution out of the Atlantic in terms of kelp and dulse from Maine to be able to comment intelligently, probably better than someone else could. So some of you are asking about other comments. So know that we are actually, the show is on 2 feeds. We're live on Facebook, but we're also on YouTube. And so if you're seeing the comments, and I'm talking about some of the comments and you're not seeing them, it's because they're over on the other channel. And so, if you're on Facebook and you want to go visit YouTube, you can see those comments, the YouTube feed. Let's scroll down. Is there a list of all the non-medicinal ingredients we can find in supplements that are bad for us? We have a list of a lot of the fillers on Gluten-free Society that you can check out. It's on our page of basically fillers that could potentially be gluten that you want to avoid. But that's actually a really good idea. I think I'll get with my team to come up with that list, and we'll publish that in the coming year in 2023. So thank you for that question. Help for countering hair loss, Gene is asking. Gene, I'm gonna refer you to our show. We did an entire show on hair loss, and I think you make the most out of watching that show. If I'm just saying something very quickly to give you something to chew on today, it's protein, protein, protein. You need, if you're losing your hair and you're not eating enough protein, your hair is not going to come back. You got to get enough protein in your diet. So if we could put up for Gene the link to hair. How do I feel about glutathione intramuscular injections? Do they work? They can. I just think that injecting your body with something, I'd rather not use injections or IVs if I can, like in practice. My thought is nutrients come through the mouth, through the gut, into the body. And I know a lot of doctors want to get them in higher doses and higher concentrations faster through IV or through IM injection. And I can respect that, especially in certain clinical situations where there may be a greater need for that particular individual. But if you're just trying to get extra glutathione as a supplement in your diet, I'm not a fan of injectables. Same thing with B12. A lot of people will inject B12. I'm a bigger fan of just good quality oral supplements, because you have to remember what you're taking, you want that to nourish your gut too. And when you bypass your gut, 40% of the nutrition that feeds your gut comes directly from what you put in your mouth. And so if you're trying to get that nutrition to your gut as well, and a lot of you, one of the top questions we get is, how can I heal my gut? How do I overcome my leaky gut? We have to nourish it. So if you bypass it by going through the blood vessels or going intramuscular, then it's just not the best choice in my opinion. My friend is going gluten-free and is diabetic. What starches would you recommend that she can eat? There's lots of starches, any kind of root vegetable, cassava, tapioca, starch. Arrowroot is an option for starches. So there's a lot of possible options there. I think the biggest thing is to pay attention to starches, because if she adds too many starches to her diabetic gluten-free diet, too much starch can also raise blood sugar beyond gluten, and so just got to be careful. I've seen some people that, like, for example, they for every ounce of gluten they're not eating, they're trying to eat the same amount they were eating in gluten in tapioca, and then their blood sugar stays high. So just keep that in mind. I think it's important to realize that, yeah, you can look for starchy replacements, just don't look for them pound for pound with gluten, because you might not end up solving your blood sugar problem. Best test for mercury, Anna wants to know, is what I like to use is something called a pre and post urinary provocation test, where you use provoking agents to pull the mercury out of storage. A pre-test is necessary to see if a person's getting consistent ongoing exposure to mercury. A post-test, post-provocation test, is just to kind of get an idea for the level of mercury storage in that person's tissues. So pre-post provocation urine test would be what you'd ask your doctor for. What test for protein status should I use? Albumin serum, is albumin serum okay? It's not, I mean, it's fine. Albumin, you can measure albumin and globulin and total protein in the serum in the blood, and those tests are fine. But for protein status specifically, I'd look more specifically at like intracellular amino acid profiles for the individual amino acids more than I would look at just like total protein, because I see it all the time where total protein is normal, but a person is still undernourished. The body's super efficient at preserving nitrogen and protein too, and retaining that through the kidney. And so a lot of times what's in your serum is not necessarily a reflection of your need for it. Just another reason why serum tests can sometimes be very misleading when you're trying to assess nutrition. Let's see, go back to the other feed for me. In a world with atmospheric radiation particles present, does apple pectin bind with and aid the removal from the body? If so, does organic applesauce provide enough pectin compared to raw apples? You know, I can't say that I could compare, you know, applesauce versus like a raw apple in terms of pectin quantity. I couldn't give you the right answer because I don't know it. And I don't really even know or haven't read any research on apple pectin being effective for radiation. You know, if I'm looking at radiation particulate and how to protect the body the most, I'm looking at fundamentals more than I'm looking at any one type of supplement product. So fundamentals being go to bed on time, exercise every day, to some extent move your body, the right diet with whole real foods that you're not allergic or intolerant to, sunshine every day, escape the cities and escape the 5G and 4G as much as you possibly can, put your cell phones down periodically and distance yourself from technology on a regular basis. And connect with the planet, connect with the earth, you know, go outside. These are things that are fundamental, I think, to humans. And if you aren't doing those things on the regular, then the radiation, especially now with a lot of the technology, the wireless technology devices coming online, you're going to struggle. I think we're going to see a lot of people, we already do see a lot of people struggling with that. I mean, you know, outside of that, beyond that, get your nutrition status tested to determine, you know, whether or not your body has adequate antioxidants to help do the work of protecting you from things like radiation, because there are a lot of nutrients that are anti-radiative. Iodine being one of the most potent, but you know, you've got things like NAC and glutathione and vitamin C and lipoic acid. You know, these are all very beneficial things that people should, you know, in my opinion, if trying to be preventative, have them measured. And if your levels are low, get them up. Eat more of the nutrients from foods and possibly even supplement to give yourself the best level of protection. What amount of NAC is safe? I go as high in some people as 4,000 milligrams a day, but you know, if you're just kind of taking it preventatively, 1,000 milligrams a day is perfectly fine and safe. If you've got a cold or flu, you know, the literature on NAC is very clear: 2,000 to 4,000 milligrams a day during the duration of the illness, not necessarily indefinitely forever, but during the duration of the illness. Okay, I think we're already a half hour over. My stomach's growling, folks, so I'm going to go eat lunch, and hopefully today's session was helpful. Hey, don't forget to come visit us at Gluten-Free Society, and don't forget to take advantage of our special sale, Ultra Food VF, this week on sale. Use promo code SUPER to save $10 off your premium gluten and grain-free greens and reds drink. So if you're in the market again for a greens drink, that's what I recommend. I get that question all the time. So take advantage of that sale. Come visit me. If you're new to our email or you're new to our show, when you're over there, sign up for our email, and we'll send you a bunch of free stuff on how to go gluten-free the right way so that you don't stay sick on these traditional gluten-free diets that really just drag people along through the mud and don't really help them. So thanks so much. I wish you a fantastic weekend, and we'll see you back here next week, same time, 12:30 on Thursday, but also 6 p.m. on Tuesday. Take care now.